And one of the things I think we need to think about when we do research is that acupuncture isn't just about putting in needles. Lots of things happen in an acupuncture session that are specific to the acupuncture. If you did a sham control trial, the only thing you'd get in here, you'd needle the points. But what about the other things the acupuncturists do? You know, they give a diagnosis, they explain the condition in terms of traditional Chinese medicine. They give lifestyle advice based on that diagnosis. So the lifestyle advice is specific to the diagnosis, it's specific to the acupuncture. And if the patients take up that lifestyle advice, that's also part of the longer-term process. So what we did in New York, I had a chance to do one more trial, and I thought this time I'm going to measure components of treatment that might have an impact long-term. So we have some rationale, if you like, for these long-term benefits. So this is a case study, and again, we're doing a 3-arm trial, acupuncture versus usual care. It was one part of the trial. We also had another arm, an Alexander technique arm. Alexander technique is about posture. It's about learning how to carry yourself in a way that helps you relieve stress and tension and improve, in this case, looking at improving neck pain. And I have these secondary research questions. This is all about the long-term effects. You know, we asked the practitioners, did you give lifestyle advice? You know, what lifestyle advice did you give and why? We asked the patients, did you receive lifestyle advice? Did you act on it? Did it make a difference? And were you able to cope better because of that lifestyle advice? Okay, so I'm trying to fill in the background, if you like, the explanations of why these long-term effects are occurring. Does self-efficacy, we use self-efficacy as a sort of measure of coping better without medication. Does the self-efficacy improve, reduce the pain? So we looked at the flow of patients through the trial. It's a 3-arm trial. We had 1,000 patients assessed. We randomized around about 170 to each arm. So this was a big enough study to find a difference if one existed. And we tracked them through to 12 months. So we assumed at the beginning of the trial we were going to get significant effects at 12 months and then work backwards and try and understand what might be feeding that, what might be supporting the long-term effects. So the key data here is we were measuring neck pain. Neck pain, we used this Northwick Park questionnaire. It's a neck pain questionnaire developed in London at the Northwick Park Hospital. And we wanted at least a minimum score. So we wanted people to come into the trial with at least quite a lot of neck pain. Because if people come in without any neck pain, you can't show difference. So we wanted a score of at least 28 on the Northwick Park questionnaire. And what did we deliver with the acupuncture? We delivered 12 sessions, and this was TCM, traditional Chinese medicine. We encouraged individualized treatments. We encouraged lifestyle advice and self-care as part, which is what practitioners normally do in the United Kingdom, where I come from, if they're practicing TCM acupuncture. And then we wanted the Alexander technique to more or less match the acupuncture. But the Alexander teachers, I said, we want 20 sessions. So I said, all right, you have 20 sessions, but we want the same number of minutes. So we ended up with the same 600 minutes contact time. But that meant that their Alexander technique lasted longer. There were 20 sessions instead of 12. So this is our primary outcome measures in Northwick Park and the primary endpoint at 12 months. These days, when you do a trial, you have to specify your primary measure and the primary endpoint and then you stick to it. So this is a bit of a gamble. And then the secondary measures were, around lifestyle advice and around self-efficacy. So we recruited the patients in the north of England. The interesting features here is that the average period of neck pain was 6 years. This isn't your average, oh, I put my neck out yesterday. This is a chronic problem, on average 6 years. This is a difficult population to treat. They also, 3/4 of them were on medication. So they were taking medication and still in pain on that Northwick Park questionnaire. And then the acupuncture was delivered by 18 acupuncturists. And the practitioners, their job as practitioners partly was to document the lifestyle advice they gave and the diagnosis they gave and the treatment they gave. So we could try and tie in with the patient story about the lifestyle advice. And so this is the graph of this study showing the outcome. So notice we've got the 2 lines at the bottom of the Alexander technique and the acupuncture. The acupuncture is the lower one, so people having acupuncture got better quicker. Their neck pain was reduced, but by 6 months, actually the acupuncture and the Alexander technique both were pretty much the same, because by then all the Alexander sessions had been delivered. And then we found a significant result at 12 months, statistically significant. So that left us with the question, why, what was going on? How can we understand that long-term benefit? So then we looked at the data, and we looked at what the acupuncturists had documented, and they said, we gave lifestyle advice to 84% of our patients. And that advice consisted of exercise, relaxation, diet, rest, work, and other factors. These are the sorts of typical categories that we found were present. The question then is, was that advice acupuncture specific? We asked the acupuncturist, give us the reason, based on acupuncture theory, why you've given that advice. And here we can look at the advice. This is in terms of the traditional Chinese medicine syndromes. Exercise advice was given to move the liver qi in 93% of the cases. So you can imagine when energy gets stuck, liver qi stagnation, exercise moves the qi, and that indirectly will help the neck pain. And so the other area that might be interesting would be the diet. You can see the diet was particularly used for those with more of a spleen type deficiency, where the digestive system was poorly performing. Dietary advice seemed to be important for 63% of those. The important thing here is, though, the diagnosis drove the lifestyle advice, and it wasn't just any old advice that was being given. And so then we asked the question to patients. We said, patients, did you get lifestyle advice? Did you act on it? Did it make a difference, and so forth? And we came up with some important conclusions. That compared to usual care, the acupuncture patients did significantly better if they made changes to exercise, changes to relaxation, to diet, and to rest. Indeed, if they made more than one change to their lifestyle, that was even better. And they reported that the extent they put that lifestyle advice into practice made a difference. And they reported improvements in self-care as a result of the lifestyle advice. And they perceived these changes as helpful. So the patients liked the lifestyle advice and acted on it. And the question then is, well, did that make a difference to the neck pain? So this is where the self-efficacy questionnaire comes in. And it's a 5-point questionnaire. The key question, I think, in this is, how certain are you that you can make small to moderate reductions in your pain by using methods other than taking medication? Okay, so this is the self-efficacy, the ability to make changes so that you can cope better and function better with less pain. And that's what we've called the self-efficacy question. And so what we found was, compared to the usual care, the changes that were made in self-efficacy were greater in the acupuncture group, significantly. And that better self-efficacy also led to more reductions in pain at both 6 and 12 months. So you see how we've come round in a circle here. We find all these long-term effects, and now a part of the solution is giving lifestyle advice that's related to the diagnosis. And if the patients can act on that advice, then that will make a difference in terms of reducing neck pain. If they don't act on the advice, they won't do so well. And the acupuncture group, they did much better than the usual care group as a result of the lifestyle advice. And this is an important argument why we shouldn't do sham-controlled trials, unless we're asking a very narrow question. Sham-controlled trials require you can't have all this learning and all these changes happening in a sham-controlled trial because you want the patient not to know they're having real or sham acupuncture. So if you want long-term effects, my argument is we need to be doing these pragmatic trials, real-world trials with everyday populations that need to be large enough to show a difference if one exists. So what are the conclusions from this talk? The first is, we get a moderate effect size from acupuncture compared to usual care or standard care. The effect size is 0.5. If ever you see this in the literature, when you read the literature, look out for effect sizes, because they do tell you, they're a standardized unit that tell you the size of an effect. 0.5 is a moderate effect, and it's a very decent one to have in a chronic pain population with multi-morbidities and so forth. And 90% of that effect is sustained at 12 months. This is, I think, one of the more remarkable features of acupuncture. We're doing something that really works or can work for the longer term. If you're comparing acupuncture to a placebo, we have a small effect of 0.2. And that's a result that is beyond bias. It cannot be criticized for being a biased outcome. And interestingly, it's very similar to a lot of medication versus placebo. In fact, paracetamol versus placebo in the recent studies shows it's around about 0.15. Okay, paracetamol is not as good as acupuncture. NSAIDs are similar to the acupuncture. The one form of medication that's commonly used for chronic pain that definitely outperforms acupuncture is opiates. But who wants to be taking opiates for chronic pain? The opiates have an effect size greater than 0.5. But acupuncture is up around about 0.5. So you want to have acupuncture rather than opiates. And my technical point is, the inconsistency in the literature is due to trials being too small. Too many small-scale trials. We need big trials. And interestingly, our studies that we've been doing with the Trialist Collaboration have changed the policy in the United States. The National Institutes for Health there have been funding acupuncture trials, but they have said, we don't want to fund any more acupuncture trials against placebo. And one of the reasons is you need such big trials to show a difference. They're unfeasibly large, 1,000 patients in a trial. And then about the long-term effects, first of all, we need to be measuring the long-term effects, because a lot of trials do only stop their study at 2 months or 3 months. We need to be doing long-term measurements. We need to document the broader components of treatment beyond just the needling, and the explanations, the diagnosis, the lifestyle advice, the learning that patients have and experience. And ideally, check that the long-term benefits are due to patients having learned something. So I think we need the acupuncture needles to kickstart a change. We know acupuncture, something happens with acupuncture often straight away. Patients get off the couch and they say, wow, that was something happened. And, people feel different with acupuncture pretty quickly. That's the needles. But it's the long-term effects. We need to embed the changes that will help someone sustain the benefit. And so improved self-efficacy, better coping, the learning that comes from the interactions with the practitioner, they're very important. And just to finish up, I've got, if anyone wants a copy of this presentation, by the way, I can maybe get it through through the organization. But I've got the publications of the trialist collaboration. They're all open access. If ever you have to argue the case about chronic pain, this is a really nice selection. And also, just one more point. Anyone, if ever you're treating chronic pain, just know that you're doing evidence-based medicine. The evidence is there now in a way that it hasn't been. It's also definitive now in a way that it hasn't been. And we can feel very good about our treatments when we treat chronic pain, knowing that they're evidence-based. And then I've also just got here all the pragmatic trials in the UK. They're all open access as well, and so you can track particular conditions. So these are all available for you if you want. So on that note, I want to say thank you for this opportunity to talk about my special passion, which is acupuncture research, and the importance of evidence-based medicine. For our field, it's extremely important that the evidence is coming stronger and stronger in favor of supporting acupuncture. Thank you very much.